Catheter ablation is a great technique which we've used to treat many and cure many heart rhythm problems. Essentially, the procedure is usually carried out as a day case procedure. Patients I do most of the procedures under a general anaesthetics, but we use a very light general anaesthetic, so there's no long-term after effects from it, and it's extremely safe. I use ultrasound to pass a couple of tubes just from the very top of the leg, and those catheters run up to the heart. Usually we use a navigation system as well as X-ray, so I can see those represented in 3D and use that to track down the exact areas of the heart causing the heart rhythm problem. We then generate energy, usually electrical energy, to either cauterize or destroy the tiny bits of tissue which are firing off the abnormal heart rhythms. And then at the end of the procedure, everything comes out and you're left with a very little stitch at the top of the leg, which we can take out after a couple of hours. Lots of people ask, how long does it take to recover after an ablation procedure? Now this is really a day case procedure, and the way we've tailored things and reduced the, let's say, severity of the procedure means that people often feel pretty good 1 or 2 days after the procedure. Normally I tell people to take around a week off work and not to get back to doing full exercise for around 2 weeks. And that's because, of course, we've put these small tubes at the top of the leg. And so that's what I'm really worried about. The heart will cope with doing exercise or whatever you want to do within a day or two of actually having the procedure. Some people feel a bit of chest pain or discomfort after the procedure, and that can be quite normal. Likewise, after we've done the ablation, the heart cells just around where we've done the ablation itself are healing. And during that time, they can actually fire off abnormal heart rhythms. So some people get some palpitations or little bursts of abnormal heart rhythms within the couple of weeks after an ablation. That's actually nothing to worry about. It's quite normal, and usually that's part of that's due to the procedure that we've done rather than being the underlying heart rhythm kicking off again. So most people can get back to driving after a catheter ablation following about 72 hours. And you don't need to inform the DVLA, but you do have to make sure that you can drive safely so that the top of the leg, for example, isn't sore anymore. Traveling after a catheter ablation is usually very safe, and normally within 72 hours, people have resting, but then it's fine to travel either by any means of transport, by aircraft and so on. But I have to say, we've had patients who've had to travel even sooner than that time, and it's always been fine. So if that's a particular concern, just ask.